Evan, I did a mute all. I'm pretty sure you've counted us down. Are we ready to go? All right, great. Thank you so much. Okay, so before we get started, okay, I just wanted to make sure to get the recording started. Just a few reminders for this evening. First thing is, per Open Meetings Act, we are live streaming the meetings now. We started that with last week's hearing, and they are live streamed on the Health Department's YouTube channel. We are recording the meeting, and by attending, you are giving your consent to be recorded. So just so everybody knows that. And then another heads up that per the agenda, we will be doing a roll call votes for all votes that we need to have. A reminder to keep your phone or computer on mute unless you are speaking so that we can keep background noise down. And a reminder to always identify yourself when speaking, and especially when you make a motion. This will help us ensure that the minutes are accurate moving forward. So with all of those reminders being said, thank you for being here, and I'll let Candy take over to start the meeting.
All right, thank you. We'll call the Macon County Health Department meeting to order. Roll call, please.
Candace Clevenger.
Here.
Paige Toth. Vivian Goodman.
We couldn't hear you, Vivian. I think you're on mute.
Okay, here. Can you hear me now?
Yes.
Yes.
Thank you. Jan Heck.
Jan Heck here.
Dr. Jerger.
Dr. Jerger, we couldn't hear you. I think you might be muted. We still can't hear any audio. I think, Candy, in my opinion, if you're comfortable with it, since we do have the live stream and the recording, then we can see Dr. Jerger is present. And also, Dr. Jerger, if you do end up having any questions throughout the meeting, you can use the chat box if your microphone continues not to work. So then that way, if there is anything that you'd like to ask or any comments, that we can still ensure that we are addressing those. Sandy, if you want to finish the roll call with everyone else, I think that would be okay.
Okay. Mary Jane Litton. Dr. Meningati. Dr. Patterson.
Here.
Phil Tibbs.
Here.
Laura Zimmerman.
Here.
That's everyone, I believe, Candy.
Oh, okay, thank you. I need an approval for the agenda topics that were mailed to you.
If it's okay, I would like to add one thing to the agenda, just a discussion regarding an update of the Popeyes hearing that was held, and I'd like to discuss that in old business, please, if that's okay with the board.
Okay.
Laura, move to approve the agenda topics.
Second, Vivian.
All those in favor, so we need a roll call vote for this?
Yes, for all agenda topics now moving forward.
Okay, so do I call a roll call vote?
Candace Clevenger.
Yes.
Vivian Goodman,
Here.
Jan Hack,
Yes.
Dr. Jurger,
Sandy, it looks like in the chat he messaged yes.
okay, sorry.
That's okay.
Dr. Patterson,
Yes.
Phil Tibbs,
Yes.
Laura Zimmerman,
Yes.
Okay, is that everybody?
Yes.
Okay, thank you. Was there any public comment?
No public comment was received and there is no public present this evening.
All right, thank you. The next item on the agenda is approval of the June 16th, 2020 minute. Do I have a motion to approve the minutes?
Phil
Motion to
Tibbs, so
approve.
moved.
Thank you, Phil. A second?
Jan Hack.
Second, Jan Hack. Roll call vote, please.
Candace Clevenger,
Approved?
Vivian Goodman,
Yes.
Jan Hack,
Yes.
Dr. Jurger, Dr. Patterson,
Yes.
Phil Tibbs,
Yes.
Laura Zimmerman,
Yes.
That's everyone, Candy.
All right, thank you. Motion passed. Is there any the communication for the board?
Yes, so in communication, I just would like to touch on our board education, and we've been keeping with the similar topic since our response to the COVID-19 pandemic began. So I'm going to continue to do that as it is still incredibly relevant in addition to everything else that we're doing here. As you might be able to imagine, if you've been following our daily releases, weekday releases now, we have been getting busier, especially in the nursing division, with the numbers steadily increasing a little bit. There are a lot of reports of non-compliance when it comes to businesses that we're also dealing with, which is more on like the environmental health, administration, health promotion, and then also now with nursing, a lot of cases are having multiple contacts since we're out of that shelter in place time period. And so numerous calls come with that. So as we've been discussing with you, we did make a plan in our clinical nursing division to cross-train staff that don't normally work in communicable disease to ensure that we did have backup staff to relieve the ones that had been working most of or everything initially. So we did implement rotating staff in our nursing division. And now, as we had planned to do if and when we needed to, we have started training staff in other divisions that are not necessarily nurses, but just other staff that would be qualified to be trained to do contact tracing and some of those phone calls to the contacts of diagnosed cases. And so that has started. There is a training that the state requires for someone to be a contact tracer. And then Carol and Annie have also been providing internal training to ensure that the staff know what they are needing and what the expectations are as far as assisting with those contacts. And we'll continue to have these staff assist as they can because, of course, all of our other services, for the most part, we're pretty much back to doing everything that we were doing before. Some of the things, again, are still adjusted a little bit in how we're implementing them, but we don't have a lot of staff with a lot of extra time just because of the regular workload that they carry, even with a pandemic not occurring. So we do have that happening until we can get our contact tracers and case investigators hired. As we had mentioned to you, we did have a grant that we applied for, and we were waiting to hear back on approval for that. And also the permission, everything, as far as with the budget and what we were going to be able to spend and on what. So I'm very excited to report that we got some feedback from the state as far as some changes that we had to make. I believe that we got that Friday afternoon maybe, and our team quickly addressed all of those things. CFO got the budget side all updated. We got justifications updated and sent that in last night. And this morning we did get confirmation that our grant was approved. So we are really excited about that because that means we can start moving forward with getting these positions hired for that we so desperately need. Staff are heavily burdened now, and I'm sure a lot of you are seeing this in your own workplaces, but people are struggling. They have things they're going through personally with this pandemic and professionally. And to work at a health department right now, especially the people that have been on the direct response for COVID-19, it's very difficult. We've asked a lot from them. You know, everybody is hired with the expectation that they are emergency responders 24/7, and they have certainly stepped up to that. But that doesn't mean that it's been easy. And we're trying to find ways that we can rotate schedules. We've been doing that for quite some time, but people are still understandably, you know, they're getting tired and it's a lot, and people need a day off here and there to kind of recharge, to have some time with their families. A lot of staff have worked 7 days a week since this started. So we're doing everything that we can to try to increase more cross training. And then of course, now that we're going to have this grant, it's really exciting because we'll actually be able to hire for these positions that we need. The amount for the grant is, and we do have the resolution for that, for the FY20 budget. And I apologize, I'm getting it popped back up here on my screen. I'm going between a couple of things. It's $2,861,712. So in public health, this is unheard of. So we are very excited, and we have, I think, a very responsible plan for how to spend this money. We do have the resolution that we sent earlier today. We couldn't write the resolution until we had the grant approved because the resolution does include pieces of what the grant will be spent on. So Sheree quickly developed that resolution. You know, we had it on the agenda to ensure that we could vote on it this evening and move it through the process with the entire county and get things moving. So, you know, very grateful that that was all able to happen today, but we can talk more about the resolution later in the meeting. Some of the positions that we will be hiring for, just to kind of briefly let you know, so that if you do know anyone that is looking for a position, you can certainly send them our way. Some of the positions, of course, like I mentioned, contact tracer and contact investigator, care resource coordinator, clinic coordinator in clinical nursing, and that's part of our restructuring plan that I've been kind of mentioning to you for months now, even before the pandemic. A COVID project director, a data manager or epidemiologist, depending on what we can find available, infection control nurse. Those are some of the positions, very specific to contact tracing. That was one of the rules, that it had to be somehow justified to directly impact contact tracing. So one of the other things in my role as the administrator that I really wanted to prioritize pre-pandemic, before anything else happened, was I felt like we've needed to focus more on health equity, diversity, and inclusion as an organization, whether that's been with our hiring or with the employee events that we have, ensuring that we're being as inclusive as possible, ensuring that we are addressing the health inequity that occurs everywhere in our country, including in Macon County. And so we proposed in our grant application a dedicated position to focus on this in our grant, and we were really, really happy to see that it got approved. The state overall is saying that they're focusing on this more now, so I think that that definitely worked in our favor, but we thought we would just throw it in and see what happened. Our goal is to maintain this position even after the grant ends. So the focus would be COVID-19 and getting started and making sure that we are hitting all of the disparate populations in our community, and making sure that everyone has the access, has the communication that they need and deserve in our community, and that nobody is forgotten. And we are really hoping to take this position and not only address these inequities and disparities with COVID-19, but across the board. You can't talk about health inequity without, you know, public health is something that you have to talk about, that health inequity, and address it. So I'm really excited that we found a way to fund this now and moving forward into our future. We also got some funds in that grant for necessary additional staff, like I mentioned. I will tell you, just as a heads up, some of these staff will probably be working remote. We're looking more at like your contact tracers, who would just be doing contact calls, and they would be required to have a confidential space based on HIPAA requirements. We do not have enough space to house all of the people that we need to hire for this grant in order to be adequate. in addressing the needs with COVID-19. And then we will have some that are internal. So just a heads up, I know there's been a lot of communication at the county level about, excuse me, remote workers. We've had remote workers. We still have some now that are 100% effective and working their full schedules and meeting all grant deliverables from home right now. Per the guidance that we are promoting to everyone else in the community to keep people home if and when you can. So I'm glad that we're able to lead by example and do that. But I do want to just give you all heads up that there would be additional positions that would be working remotely. So that if there's more discussion around that, that you understand how that's going to work. We did build into the grant the technology needs that we would have to have in addition to what we've already done here at the health department, so that those people could have everything that they need in order to be as successful and efficient as possible. We also were able to get funding to address some community needs, such as alternate housing for cases and contacts. That's been a big point of discussion for our community, county, city, EMA. Across the board, there have been concerns about if someone needs alternate housing, if they cannot isolate in their own home or they cannot quarantine, where can they go? Who can pay for that? What if you have someone that's diagnosed with COVID and they're homeless and they don't have anywhere to go that they can isolate, or you have someone maybe that works in a healthcare facility and they don't want to bring it back to their family, and there has not been funding for this locally up to this point. We have been able to access resources that have been in areas like Springfield and Champaign, but now this grant did require and provide for funds that we would be able to take care of our local county residents if and when this need arises here locally without having to send them out of town and burden them even more. And then also there were some building needs that we're going to be able to address with this funding. Another thing too, related to COVID, if you remember, I know it seems like a lifetime ago now, but back in April at our board meeting, we did discuss the COVID crisis grant, which was a much smaller amount of money that we could use for COVID response needs. And some of the things that we did with that funding were some of the progressive technology updates that we had to have in order to get our staff as remote as possible. And another thing that we had put into there was the payout of flex or overtime, essentially, for staff whom have worked an abundance of overtime or flex time. You all approved a policy in March regarding flex accrual adjustments because we did have such a small team of staff that were working so many hours. This time would not be feasible to be taken, especially with some of the amounts that people have fairly accrued. And especially with no end date to a pandemic, we need our staff. So this grant and then some of the other funding that we've gotten that you've probably heard about in the media allow for the payment to staff of this time. And many health departments have used this funding and plan to use this funding for this exact same purpose. So this is not outside the scope of what's being done anywhere else. So we wanted just to make you aware because we are going to start working on getting those payouts completed. And that does continue through the end of December. So if things continue as they are and or get worse, then we do have that there, that grant funding there that is meant for that. So if anybody has any questions specific to any of that, I can definitely answer them. Of course, if you don't think of a question tonight and you have a follow-up question on another day, please feel free to get a hold of me anytime. And that's all that I have for communications.
Thank you. Any questions for Brandon? All right, presentation, acceptance of finance report.
Okay, the financial report is through the end of June, and we were 58% into the fiscal year. The ending fund balance was at 4.8 million. Total revenue is at 3.5 million, which is 55% into our budgeted total revenue. Total expenditures was at 3.3 million, which is 51.7% into budgeted expenditures.
Do I have a motion to accept the financial report?
It's Laura, so moved.
Thank you. A second?
Second. Vivian.
Good, thank you, Vivian. Roll call vote.
Candace Clevenger,
Yes.
Vivian Goodman,
Yes.
Jan Hack,
Yes.
Dr. Jerger, Dr. Patterson,
Yes.
Phil Tibbs,
Yes.
Laura Zimmerman.
Yes.
Thank you. Motion passed. Next, we have the review of department expenditures. You have them listed in your packet. Do you have any questions for staff? If not, motion to accept.
Phil Tibbs, so moved.
Thank you. Second.
Laura, second.
Thank you. Roll call vote.
Candace Clevenger,
Yes.
Vivian Goodman,
Yes.
Jan Hack,
Yes.
Dr. Jurger, Dr. Patterson,
Yes.
Phil Tibbs,
Yes.
Laura Zimmerman.
Yes.
Thank you. Motion passed. Any grant applications for review?
No.
You have a copy of the departmental division reports in your packet. Do you have any questions for staff? All right, we have employee recognition. Teresa Smith, 18 years. Jennifer Bradshaw, 2 years. Bethany Staple, 2 years. Lauren Allen, 1 year. Thank you for your service. Old business, we have some information about Popeye.
Yes, Kathy's going to give an update. I did want to say thank you again to the board members that were able to make it. I know that was a difficult time, as many people, do work during the day. So it was hard to find a time that worked for everyone. So thank you so much for taking the time to do that. But we did want to have Kathy give a brief update just so everyone can be updated. And then, of course, we will get minutes out to you that you'll be able to review and approve next month as well.
Good evening, everybody. And to mirror off of what Brandy just said, thank you to everybody who was able to show up and participate in that. It was our first hearing we've ever held, so it was a learning curve for everybody. Quick update, the reason why Popeyes was in the situation to require a hearing is they were closed on January 10th of 2019. That was their first closure. They were also closed on June 18th, 2019. Per our ordinance, anytime you have 2 closures in a 12-month period, it's supposed to be an automatic revocation. After listening to them, their side about some of the issues that were going on internally within the store, we decided to basically send them a letter that said, okay, we will continue to work with you in good faith. You have to uphold, certain things. And one of them was that the next time that there was any type of closure, it would be automatic revocation. That letter was issued June 26, 2019. On June 23rd of this year, Jerry Brown went out, did an inspection, saw quite a bit of, a lot of issues going on there. And they did an immediate closure at that point, which brought us to where we were last Tuesday on the 14th of July in a hearing. I will say that all 3 closures were issues to where Popeye should have closed on their own prior to even opening and handled the situation on their own. However, the 3 took us to go out there and whether it was a routine inspection or complaint. So we are at this point, their license is still revoked at this point. I know Brandy has heard from their corporate counsel and she can fill you guys in on that one. But if you guys have any specific questions about the hearing or Popeyes, I'm here to answer them, or, you guys can always email me.
Are there any questions for Kathy? Brandy, do you have more to add?
Yes, I was contacted yesterday afternoon by their general counsel down in Texas, who stated that this, got their attention because the situation was not taken care of when it should have been, and it got to this point. So they basically were just asking how they can get things back on track to be able to get the store back open. So I am referring them to our legal counsel because there are steps that they can follow at this point. So just so you all know, we'll keep you updated, of course, but I'm going to be forwarding that on to Mike Baggett to give us some direction on how that should be replied to.
All right, thank you. So now I'll move to new business. You have approval of updates to personnel policies.
Okay, so we did send these to you in your packet. We did highlight what was changed to try to make it as simple as possible. Simply what we're trying to do is adjust all benefit time usage increments to be 0.25. Historically, the way it has worked is that you can take sick time in 0.25 increments, flex time in 0.25, vacation days in a half day, and personal time by the hour. So it makes things very, very complicated, confusing for our staff, more difficult to manage for the supervisors. And, you know, we've had cheat sheets and things in the past and training to make sure that everybody understands. But we did an assessment with our supervisors and then with administration, who manages a lot of the details of the time clock that we have. And it was determined that this would be the most efficient way to move forward and simplify everything so that everyone could use their time as they see fit, and also not make things as complicated or for people to have to use more time than they actually need on a given day for something like, you know, a doctor's appointment or something like that. So we're just simply asking you to approve that edit. We will do our annual review of the personnel manual still later this year, but we didn't want to wait with this. We'd like to get this changed now so that we can get this implemented as soon as possible.
So I need a motion to approve the updates to the personnel policies.
Motion to approve, Vivian.
Thank you, Vivian. Second.
Second, Jan.
Thank you, Jan. Roll call vote.
Candace Clevenger,
Yes.
Vivian Goodman,
Yes.
Jan Hack,
Yes.
Dr. Jerger, Dr. Patterson,
Yes.
Phil Tibbs,
Yes.
Laura Zimmerman.
Yes.
Thank you. Motion approved. Next, we have the approval of the Macon County resolution for the health fund budget. Tracy?
Okay. This is the resolution that I referenced earlier that was sent out. Is that better without the echo there? Okay. That was sent out earlier this afternoon. Again, I apologize that you did receive it this afternoon, but we did just get the grant approval this morning and could not complete the resolution without knowing what was approved in the grant. And there were some, you know, significant things in there. So we wanted to make sure it was as accurate as possible before we did present it to you for your approval. So I did give you a little bit of information earlier about what was included in the grant. I'll give you a more broad overview now. And if you want to get into any specifics, I'm more than happy to do that. So again, it is a COVID-19 contact tracing grant. So everything that we had to, or that we applied for, we had to justify that it was meeting the deliverables and the purposes of contact tracing. So the funding will support building capacity. So that's going to be where we have competency training, human resources, staffing, interpretation services, literacy services. Also responding to outbreaks in congregate settings. As you all know, early on in this, we did have a large outbreak in a long-term care facility. There have been additional outbreaks up to this point. Our staff have been completely managing that in addition to everything else that they do. And that's been, you know, very challenging. So we're excited to be able to add some staffing on to assist with that need. Another objective of the grant is resource coordination, and that's where I did mention alternate housing. Other things that we will be able to assist in coordinating for people, this is going to be more of like a referral and assistance role, would be food. If someone is staying at the hotel because they needed alternate housing, they do need support to be able to get food, or even if they're at home and they can't get to the grocery store because they're quarantined or isolated. So that's something that this care coordinator would be able to assist with. Gaining medication, social services. So there will be an entire position dedicated to that. Also promoting testing among vulnerable populations that experience health disparities, ensuring health equity, and addressing community and regional approaches for successful sustainability of local contact tracing programs. Another thing we have to be as prepared for as possible, while it is not specifically contact tracing, is being prepared for mass vaccination clinics when we do get a vaccination available. If you all remember H1N1, we had large vaccination clinics for that. So I can't imagine how significant these will be, but we want to be as prepared for those as we possibly can. So like I mentioned, there's a lot of staffing needs in there, materials for nursing as far as any supplies that they might need. Some technology needs are addressed. Translation and interpretation services are in there, alternate housing, security, remote management software, technology that they're going to need if they are remote workers, such as phones, printers, scanners, computers, all of that. So all of those components are in there. It will really help build some infrastructure. This grant is only a one-year grant. So we, obviously will be very forthcoming with the people that we interview that it is a grant funded position. Hopefully with all of this COVID-19, there will be a recognition of the need for increased public health funding, since public health is every year inadequately funded. So hopefully some of those positions, if we do find that we need them on a continuing basis, then we're able to do that moving forward. And we do have some plans already in the works as far as what we think we do need in moving forward, and to ensure that we can be as efficient as possible and have people maintaining realistic workloads in our offices. So if anybody has any questions, I'm happy to answer those, or if there's any specifics anybody wants, happy to provide anything else that you would like as far as this goes.
It looks like the budget on there is for 1.9 million, and you said the grant amount was 2 something.
And this would be,
Same question.
sure, you can go ahead.
No, I was going to ask that same question because you mentioned 2.8 million earlier, and it's 1.7.
I can explain that. Okay, so the grant began June 1st and it ends May 31st. So it will cross between 2 fiscal years. So this is just 6 months of the budget, and the other 6 months will be in the budget that we will be presenting next month or the month after, maybe. We'll see.
Okay, thank you. I thought that might be it. Do I have a motion to approve are there any more questions? Do I have a motion to approve the resolution?
So moved.
Thank you, Phil. Second?
Second, Laura.
Thank you. Roll call vote.
Candace Clevenger,
Yes.
Vivian Goodman,
Are you there? Yes.
Jan Hack,
Yes.
Dr. Durger, Dr. Patterson,
Yes.
Phil Tibbs,
Yes.
Laura Zimmerman.
Yes.
Thank you. Motion passed. The next agenda item is approval of the FY21 grant application for caregiver services.
Okay, this is actually for Starting Point, and this is a grant that we have each year, so this is not a new grant, which is why it wouldn't have gone through the grant applications for review. This is simply something that the funder requires us to have our board approve this particular grant, and it has to be recorded in our minutes. So for those of you who have been on the board for a while, this probably sounds familiar. We do it every year, and basically it's just something that we can show documentation that the board has approved us to have this application.
Thank you. I need a motion to approve this caregiver services Starting Point grant.
Motion to approve, Vivian.
Thank you, Vivian. Second?
Second, Janet.
Thank you. Roll call vote.
Candace Clevenger,
Yes.
Vivian Goodman,
Yes.
Jan Hack,
Yes.
Dr. Durger, Dr. Patterson,
Yes.
Phil Tibbs,
Yes.
Laura Zimmerman.
Yes.
All right, motion passed. Thank you. Next item is approval of a Board of Health member.
Okay, as I mentioned last month, there was someone that was possibly interested from DMH. So I did follow up on that and I did hear back, and it was Susan Crows. She goes by Sue, and I did speak with her to see if she would be interested. I got her all of our orientation information so that she could review it and determine whether or not she would like to move forward in having her name presented to the board. She was very interested. She did send me a resume and a short personal statement that I'll read to you. It says, my personal statement would include that I am a Decatur native. I attended Decatur Public Schools and graduated in 1978 from Eisenhower High School. As you can see by my resume, I accepted a position at Decatur Memorial Hospital as a new graduate nurse and have stayed there my whole career. My various nursing positions speak to my eagerness to learn and grow in my profession. I've taken on many interesting challenges, including the opening of the interventional cardiology program, and open heart surgery services for our community in 2002. My current role as Executive Director of Critical Care Services and Cardiovascular Services pulls together all of the areas that I have loved helping develop over my career. I would enjoy the opportunity to be able to grow in the Decatur community service area through participation in the Macon County Board of Health. Thank you, Sue Crows. So I told her, as you all know, that I would present her name to you. And if the name was approved, that it would move on to the county board chairman. If he approved the name, then it would be presented to the full Macon County Board for approval.
Any questions for Brandy? Any discussion? Do we have a motion to approve?
Phil Tibbs, I've known Sue Krause for years. I would move to approve her for Board of Health.
Great, thank you. Second,
Second, Laura.
thank you. Roll call vote,
Candace Clevenger,
yes.
Vivian Goodman,
Yes.
Jan Hack,
Yes.
Dr. Jerger, Dr. Patterson,
Yes.
Phil Tibbs,
Yes.
Laura Zimmerman.
Yes.
Thank you. A motion approved. Is there any other business?
No.
All right, a motion to adjourn.
So moved, Vivian.
Second,
Second, Jan.
do we need a roll call vote for this?
Let's do one just to be safe. You're okay with that?
Candace
course.
Clevenger,
Yes.
Vivian Goodman,
Yes.
Jan Hack,
Yes.
Dr. Jerger, Dr. Patterson,
Yes.
Phil Tibbs,
Yes.
Laura Zimmerman.
Yes.
Well, thank you for your participation. Have a good night.
all.
Thank you, everybody.
Me too.
Take care. Have a good one.
Bye-bye.
Everyone.
Thank you.